There are two types of image receptors currently used in dentistry today. One of them is traditional film and the other is electronic or digital sensors. Today we're going to be investigating all the characteristics of traditional intraoral film. Film comes in 5 basic sizes that I have in front of me. The smallest is size 0, which is also referred to as pedo film because it's used on small children. The next one is size 1, which is slightly narrower, and is commonly used either on children or on adults for anterior periapicals. This one here is size 3. It's not used that often, but it can be used as a longer, narrower bite wing. And the most common adult film, used primarily for posterior periapicals. The final one is the largest, which is a size 4, and that is used for occlusal projections. Film speed is identified by the manufacturer on the box with a capital letter either A through F, A being the slowest and F being the fastest. The ADA currently recommends using at least an E-speed film. Speed refers to the sensitivity of the film to radiation. So the faster the film, the less radiation required, and thus the less radiation emitted to the patient. Another characteristic that you want to look at on film is the expiration date. On every manufacturer's box, there will be a sticker that tells you when the film expires. So some operators find it helpful to label the ends of boxes with the expiration date, and so when they're stocking the film, they can be sure and use the film that's going to expire first. Some other things that we want to look at are on the film itself. Every dental film will have an identification dot, and if you just run your finger along the front of the film, you'll feel a little convexity. You'll also see a circle on the back side of the film. That brings us to identifying what is the front of the film and what is the back of the film, which is very important when we come to place that in the patient's mouth. Most manufacturers will identify the back of the film with a color, and the front of the film will be completely white. So if you notice, even on these different size of films, the back all has a color to help distinguish that. The backs of all of these films also show you where the dot is. Another characteristic of film that you want to take note of is the way that it's packaged. If you open the end of this box, you'll find an interior compartment that actually houses the film, and that is lead lined. And the reason for that is to protect the film from any sort of film fog that could be caused by lighting or scatter radiation. The last characteristics regarding the film packaging is you'll want to take note of whether or not the film is a 1 film packet or a 2 film packet, and that will be listed here on the box. It'll be located here, and this is important because this tells you how many films are actually in the packet, so that when you go to process, you can know how many films you're going to be looking for. Now we come to opening the film and all the contents that are actually within each individual packet. So when I look at this film, the back of it says 1 film. So that means that there's only 1 dental x-ray inside this packet. And to open any of the film packets, you just simply grasp the pull tab on the back side and open the top. And then once you do that, you'll find the black paper and the lead foil inside. So when we're talking about the contents inside a film, if we're going from front to back, the contents would be the waterproof plastic cover first, and then next the black paper. The purpose of the black paper is to protect the film from light. Then in the very center we would have either 1 or 2 dental films, depending on the packet, covered by the other side of the black paper. And then the back has the lead foil, and then finally the last layer of plastic waterproof coating. So that's really important. You have to know that for your exams, exactly what the components inside of the film packet are from the front to the back. The reason that the lead is at the back is because when this is placed in the patient's mouth, the lead will absorb the scatter radiation. So again, knowing the front from the back is vital, because if you were to expose from the back, we wouldn't have a diagnostic image. The contents of all film packets are just like this, regardless of the size or manufacturer. The only difference is whether or not the packet contains one film or two films. And those are all the characteristics of film.